Welcome to the Global Integral Beauty Networking event, an innovative platform that seeks the best professionals from the global industry to connect and build an interdisciplinary community working together for the benefit of patients. Hosted by Adalis Bailey, global leader in the integral beauty field, a registered nurse with an MBA in marketing, skincare specialist, and CEO of Renew Aesthetics. Adalis Beauty Savvy and Global Integral Beauty, also a best-selling author. This is a revolutionary opportunity to create professional networks in the fields of health, wellness, and aesthetics, driving global collaboration. Get ready to enjoy an event full of connections, knowledge, and innovation. Welcome to the Global Integral Beauty Networking.
Good afternoon, everyone. I'm so happy to be here with you. This is our homework that we are doing every month without stop during 4 years consecutive. I'm so happy to share with you guys. It's amazing time for me every month, and I enjoy this like the first one. And our topic today is efficacy, safety of facial treatment with applicants. We have amazing VIP guests today, and let's go to enjoy all together. Today what we're going to spend during this networking, the skip is VIP, international speaker presentation, discussion panel about the same topic that we was talking before, audience question, every question that you have, we are open for you. We have our VIP guest. This is Brooke Kennedy. She's going to do the questions, is talking about the discussion panel, and also she's going to, at the end of the question, she's going to talk about their own experiences according to this panel and the global integral beauty news.
For our general question, so Nichelle, how could you collaborate across your specialties to design a protocol that not only ensures aesthetic efficacy and clinical safety, but also addresses emotional well-being and long-term sustainability of results, avoiding fragmented approaches, and delivering a truly positive impact on the patient's quality of life?
So I really love this question, Brooke, because, we've had the opportunity to work with case studies, and I think that it's so important for us to really do a deep dive on, what it means to fully think about the whole person. So as a practitioner that's grounded in corneotherapy and, who has also somatic wellness, being able to facilitate that, I approach more of the aesthetics and treatment with rejuvenation treatments through the lens of repair and preservation before I start any sort of transformation. So that's how I would initially address things with Laura. If she has concerns that's more multi-dimensional, and she would need a protocol that I would feel that would go beyond just the surface level, to help with integrating more of a collaborative framework. So as someone who is, like I mentioned, that corneotherapist, I would begin with more of a barrier restorative type of protocol that includes a comprehensive consultation to determine her barrier integrity, her skin resilience, and also her tool to just also support the skin before, during, and after facial devices, and making sure that she had the right types of treatments, including any sort of non-inflammatory treatments and ingredients that she was using at home, incorporating physiological lipids, antioxidants, and thinking more of a corneotherapeutic biomimetic type of skin identical ingredients for her overall skin concerns. And I would really want to refer her to a naturopath or someone who is an MD. I personally am an integrative nutritionist, That's part of the certifications that I have. But just finding out a little bit more about her quality of life when it comes to her estrogen levels and what she's experiencing. I would want her to, really find and get her hormones evaluated by an MD. So, when it comes to perimenopause, that's not something that a nutritionist really has a lot of understanding about. So those deficiencies are something that I would say that, I would be out of scope for me. So I would ask her to kind of get with her naturopath, find information on being able to support her collagen synthesis, her mitochondrial health, and also, just based on what I'm noticing from her pictures and the things that she's experiencing based on, what it says here based on her medical history. She could also want to look into, glycation regulation. So making sure that she's, taking antioxidants and foods that are meant to help with much more density in that area. I would also consider, more somatic wellness if it's related to a more trauma-informed type of nature. I would recommend, her to just kind of implement a body-based sort of practice to address the emotional self-images that she might be experiencing. Just based on what she said when it comes to, her experiencing some things that were considered a little bit more deeper. Feeling like the phrase I think that she used was feeling like she was fading. And to me, that suggests a more deeper disconnection. So that through my somatic lens would kind of, address it in a more emotional sort of way, looking at her self-image, looking at the way that she's kind of thinking of, her body, and is there any sort of dysmorphia that's kind of happening in her eyes? Thinking about even chronic stress levels and how they can shorten telomeres. Those types of things would be what I would want her to really focus on and get an idea about, just how she can sort of regulate that and have that deeper connection that she seems to be disconnected with.
Thank you, Michelle. This is the general question. It's going to be the same for Stella, and then you have individual questions.
First of all, thank you for this opportunity to share my ideas and how to approach this in this care, because I've been seeing a lot of people in my client-wise, exactly same like depression. They are not took care of themselves in the beginning, and they look at themselves that they look faded. So this is really important how we approach them. So I believe in a collaborative, layered approach where each treatment not only enhances appearance but also we support their emotional wellness, confidence, and lasting beauty. That's the most I focus on as a holistic aesthetic. And when we bring together injectables, device therapies, dermatology expertise, and experienced master esthetician and emotional support into the whole unified plan, we are not just enhancing the face, we are improving their lives overall. That's the real purpose of aesthetic medicine, and I'm so excited to explore how we can do that even better, and we all together. So collaboration really starts from the moment we first meet the patient. I assess the whole person assessment throughout the deeper consultation, even if I feel like I become a psychologist. So when someone like Laura comes in, dealing with the mid-face volume loss, skin laxity, and the emotional of the perimenopause, it is so important that we see the full picture, not just the surface concerns. That means everyone involved, injectors, device specialists, medical estheticians, and dermatologists we are on the same pages to already understand this person. Laura. Ideally, we are either consulting together or working from a shared understanding of her goals, her lifestyle, and what she's going through both physically and emotionally and mentally. It's also very important that we help her reconnect with her true beauty, not just in how she looks, but in how she feels and sees herself. We all become consultants in that moment, gently guiding her to understand why she deserves to care for herself and why it's okay to prioritize her well-being. We also need to acknowledge that aging is a natural and beautiful process, and accepting it doesn't mean we cannot care for ourselves. It means we deserve the best, most thoughtful support as we age, so that we can continue feeling strong, confident, and radiant at every stage of life. When we approach her care as a team, it builds more trust. She feels seen and supported as a whole person, not just treated in part. And when she's empowered from the inside out, our treatments don't just create a result, we create the transformation.
Beautiful answers, you two. Your patients are in wonderful hands.
We're going to continue with the individual questions, and then we're going to share a couple image from the international speaker.
So, Nichelle, from your specialty, how do you assess the impact of microneedling with radiofrequency on tissue with accumulated sun damage and oxidative stress? What specific considerations would you apply to protect and support the epidermal barrier integrity, and how would you integrate somatic practices or social emotional learning strategies to enhance both the skin's response and the patient's sense of well-being throughout the process?
So, when it comes to microneedling and doing that with RF, I hold a little bit of a cautious stance, just due to the long-term effects on collagen architecture and tissue volume. So while RF, it does enhance, like the overall microneedling, it improves that temporary skin texture and collagen stimulation, through that controlled wound healing. It's also crucial to understand that RF is also inherently lipolytic. So it's designed to dissolve fat, which would make it, suitable for certain areas or localized contouring, in my opinion. But it's counterproductive in the areas like the mid-face or, when you're trying to preserve volume. I think when you're wanting to have that vitality and youthful look overall, that repeated thermal injury that can come from RF is much more of an aggressive approach than a corneotherapist would take. So that protocol may, in our sort of experience, how that works and what we typically tell clients is that, this could potentially lead to collagen distortion, resulting in fibrosis of the development of more of like a type of fibrotic and less functional tissue. So this helps us to, kind of move away from, like that more functional, more resilient type of approach that we're looking for. This is going to be more of like a rigidity kind of counter reaction to the goals that we're wanting. And so instead of doing a kind of, regenerative type of aesthetic, I think that this is a little bit more counterproductive in the approach. So I would personally advocate for them to just do more of like a standalone type of treatment, where microneedling is performed, and they would do that and have like a full, preconditioning, of course, and personalization prior to doing that type of treatment of significance. But I would put together like a timeline that they could, sort of put that in a much more respectful kind of approach, instead of just unnecessarily kind of putting it.
Thank you, Michelle. We'll continue with Stella. The individual question for Stella.
Okay. So Our clinical goal is number one is a restore mid-face volume and improve facial harmony, lift the tighten and the lower third of the face, rejuvenation skin texture and tone, addressing enlarged pores, sun damage, and pigmentation, support skin resilience during and after the hormone shift of perimenopause, and finally enhance self-image through subtle yet transformative aesthetic improvements. The benefit of my combination is I would start with the skin structure such as Wool Therapy Prime and Serum X, which is RF microneedling, and lastly we're gonna address derma filler. Wool therapy stimulates collagen and elastin in the smooth and deep dermis layer, improves skin laxity. Uses microfocus ultrasound to target the smooth and deep dermis, promoting collagen and elastic production. This is excellent for lifting and tightening, particularly in the lower face and jawline, where Laura shows mild to moderate laxity. The Cefomax is newest technology as a RF microneedling because it has a two mode. This targets dermal remodeling, improves skin texture, pore size, and skin tone, combines RF energy and pulsed microneedling, offering both dermal and mechanical stimulation, especially effective for skin texture, enlarged pores, and pigmentation, addressing lower sun damage and periorbital hyperpigmentation. It has a dual mode, continuous and pulse mode, allows vascular targeting, useful for reducing erythema and inflammation seen in perimenopausal skin. Lastly, we're gonna use derma filler, which is HA filler, hyaluronic acid filler, radius sculptura, such as collagen fillers. So she went through a lot from her life, throughout the whole life, and then now she has she's going through a lot. And then this one is before when she come to me, and this is after photo. So in the beginning,
more defined, no?
Yeah, more defined, more useful. And then we address with the wool therapy for the jawline and skin tightening, and then lifting. And then after the 6 weeks, I follow by the filler for under eye area, and also a little bit of lip filler.
Her lips too, and the eyes looks more fresh.
Yeah,
looks
and she
amazing.
looks happy.
Yes,
yeah,
she looks happy, and she looks young, definitely. It's a big change.
Yeah, so not only that she going through a lot, and she experienced a lot of things. She shared her life with me. She open-minded. She's not the type of person to open her mind, but now we become, good friends. So she allows me to posting her life journey to influence other people as well.
Wow, beautiful.
Thank you, Stella, to share this experience, because that's beautiful to know what you're doing and to continue refer you new patients and also all the community too. Continue with our VIP guest today is Brooke, international speaker too, and she's going to get one of the award recognition too. And today she's going to do the recap about this meeting, this networking. Brooke.
Yes, thank you all for being here today. I really appreciated the approaches to how you would address Laura's care, and I just enjoy learning something new, especially from Stella, who does fillers, and learning more about that information, but just how you both truly take that holistic approach, care about the emotional well-being of the client, treating holistically, which mind, body, spirit, and emotions, how you each have very strong referral networks to be able to refer your patients to, and how you do an excellent job of truly educating the clients.
Thank you, Brute. And definitely, we are in the best industry in health,
Absolutely.
wellness, and aesthetic industry. That's why we create Global Interior Beauty, because we mix that community, and we started from zero, and now from invisible, and now we are invincible. We are a big community. We are working together. We are in the right path. We are in the best industry, and that's the idea. The diversity and inclusion. Everyone have the opportunity here, but also it's beautiful when we work as a multidisciplinary. I love to hear the experience from Nichelle, but also from Stella. And they are in different areas, but at the end, we have to work together, because part of this work is coming from Nichelle, part of this work is coming from Stella. So that's the most important also for Brooke, also for Idalis. What we are doing now is just to offer our patient the real expectation with our license, with the real work that we can do. If we cannot do the work, we are allowed to refer this patient for another professional without feel bad, without feel like this competition. Is the opposite. This is what I'm doing now. And my network is all my co-author. I have all the 3 books, all who are in here in New York. When I have my patient and I'm not doing that treatment, I refer them. And I give them the book. They say, this is one of the VIP, and you can go for this professional, this 100% safe, and you're going to feel the same than me. And that's the idea of how we work today. That's the most important. When we are growing, we never thinking that there is a competition. It's the opposite. Today, we have in our hands minimum invasive treatment, non-invasive treatment, and invasive treatment, that is plastic surgery. And all are good, depending of the patient needs, and also according to their concern too. So we have to respect their concern, but also we are allowed to guide them in case that we cannot do that. Thank you again. It was amazing experience to hear all your expertise and also your patients' resolve. Michelle, I would like that you share in a couple words, how was your expectation when I invite you for this networking, and also just share how was your experience today.
Say that it's been such an overwhelming, amazing experience. Just being a part of your network and a part of the community. Everybody has just been so welcoming from the moment that I've had the opportunity to speak to you, and just being able to work even beyond, what we've done here, just connecting on a regular basis and having the opportunity for us to just collaborate and, really speak to our specialties, our niches. I really feel like the more that we all share, the better our industry really is. And, so I appreciate the ability to just, be a part of your network, to kind of be brought in the fold like family. And, I'm really thankful. So thank you. Very grateful.
Thank you very much. And we have the special certification as international speaker too. Stella, we are so happy with you here. And I really appreciate your time. Could you share what was your expectation when we invite you, and also a little bit share about your experience today?
Okay, this is my first experience that work with other expertise and professionals such as Brooke, Idalis, and Nichelle. It's just amazing to meet out there. What is out there? It's kind of, I was inside of box. I kind of more open to it, and then this is a really good opportunity to share our knowledge and skill for what you have it. We work together, not compete each other, in order to give the best service to our clients. So being part of this kind of beauty community, I never knew that it's kind of really, really amazing, and it's really inspiring experience for my professional and personal. And I'm so glad that I met so many. I'm expecting in October that so many passionate, talented, and supportive professional who genuinely care about helping others and feel their best. It is really amazing to work with the best people. So this is the really good community that I begin with to work with the best expertise. And I believe our aesthetic beauty is not just about the outcome, it's not just about the result, it's about empowerment, connection, and growth together. I've learned so much things from Nichelle and different perspective and Brooke, and thanks for hosting Dallas. I'm really grateful to be part of this community that constantly uplifts and we can motivate each other. Thank you.
Thank you, Estela. And the last couple word for our VIP today, Brooke. I would like to hear how you was as a international speaker in the previous networking, but today you are as a moderator, so it's different position. Could you please could you tell us how was your experience today?
I just love listening and learning, hearing their various approaches, just really how they did an excellent job of considering Laura's goals. And it is a beautiful community. So it was fun just to be a part of it and be here and meet people virtually. So thank you for creating such a wonderful community.